Sooner rather than later, some Americans will be encouraged to get a COVID booster shot. With the more contagious Delta variant spreading and more mutations expected, doctors say a third shot will better protect our most vulnerable populations.
An additional dose could help increase protection for these individuals, which is especially important as the Delta variant spreads.
The FDA is expected to authorize a COVID booster shot for people with compromised immune systems. CBS 4's Sean Chittin is live in Denver tonight. And Sean, we're back to that point. We want to make sure that our most vulnerable neighbors, like older adults, are protected.
Jim, that's right, and experts explain that this is all because not enough people have gotten the vaccine already, and we're focusing on those that will need another dose based on how our own immune system will react when they are working with the 2 doses we already got. A doctor at National Jewish Health explains that vulnerable populations were always less likely to have that same level of protection from COVID-19 even after getting the vaccine. It's not about the shot, it's about how well your body reacts to it.
It is the individual's response that we're really concerned about. So if you have a normal immune system, right, you don't need to run out and get a third dose.
A COVID-19 vaccine is not a medication that gives you protection on its own. The first 2 doses help your immune system to fight the virus.
But if you have an impaired immune system and maybe you can make antibodies well, maybe you can't, that's really when we would think about doing that third dose.
That includes people who have cancer, got an organ transplant, or take other medication that affects their immune system. The booster shots will focus on people and their individual conditions for now, but looking at older adults is a likely next step.
As this goes on, as vaccine is more available, as we really try to optimize our strategy for keeping all of us safe and healthy, looking at folks that are over 65 or 70 makes a whole lot of sense.
And those first up to get a new shot of the Pfizer or Moderna vaccines are still asked to follow the old guidance.
We have always suggested to them, you really need to keep wearing a mask, you need to keep social distancing. We don't know how well you're going to make antibodies. We don't know how well your immune system is going to respond. Be prudent, be cautious.
And we're talking about a booster shot for those with the Pfizer and Moderna vaccines because more research needs to be done before we can see if that is necessary for someone who has the Johnson & Johnson vaccine. Reporting live tonight in Denver, Sean Chittin covering Colorado First.
Thank you, Sean.